Hello, and welcome, or welcome back, to this ongoing series, Autism Spectrum Disorder in Three Dimensions. My name is James Coplan, MD, and I will be your guide to this material. In this segment, I'm going to flesh out the 3D model a little bit more fully, and in subsequent segments, I'll talk about the advantages of this model in terms of anticipating your child's needs, trying to match the appropriate therapies to where your child is at any point in time, and what this model may portend for the long-term future. So let's jump in. Last week, we spent a fair bit of time reviewing the fact that autism spectrum disorder has a natural history of improvement over time. And when a clinician uses the term natural history, what it really means is the expected changes in the condition in the absence of any intervention over the course of that condition. So here we have symbolically represented your child's atypicality. In other words, we've kind of bundled together the social skills issues, the language issues, the repetitive behavior issues, the sensory issues, and we're calling all of this atypicality. And over time, what we see is a steady diminution in the expression of all of those symptoms. Over time, in other words, the ice melts. However, the rate at which and the degree to which the ice melts are both affected by the IQ. Remember, there's nothing in the definition of atypicality about IQ. There's nothing in the definition of IQ about atypicality. They're independent, like height and weight. For any given height, you can be broad or skinny, so you can be tall and skinny, tall and broad, short and skinny, short and broad. Height and weight are independent, and the same is true for IQ and atypicality. They're independent, but they occur in different combinations. And just like somebody who's tall and heavy, like a sumo wrestler, has a different body build from somebody who's tall and thin, like a basketball player, or short and thin, like a jockey, the different combinations of degree of atypicality and level of IQ all look different and evolve somewhat differently. Here we have a table that you may recall from last time and previously. What we have here are the various areas of atypicality, and again, because I'm 71 and a crusty old curmudgeon, I give myself permission to retain 4 areas rather than 3, as the current DSM prescribes, and I think there's some value in looking at it my way. So we have social, language, repetitive thoughts and behaviors, and then sensory motor. And remember, across the top, what we have here is either decreasing atypicality or increasing age, because both are true. At the youngest point in time, typically at the time of initial diagnosis, the symptoms may be very markedly pronounced. And then as time goes along, a lot of things improve. This TOM over here, by the way, stands for theory of mind, and we'll get to that in a subsequent post. But things go from severe to moderate to mild. Now, not every child starts over here at the severe end. Some children never were here. Even at the onset or at the time of initial diagnosis, their symptoms may only be here or here. So this doesn't mean that everybody travels the whole path. But we have all of these areas, these 4 areas, and we have a gradation of expression or a diminution of expression over time. They're both true. And what we did was we blenderized all of this together to make the x-axis of a graph going from severe to moderate to mild, and over here in quotes is normal. And remember, there's no sharp border between being on the spectrum and being, quotes, normal. And then we also developed a graph of IQ, with 100 being average, 1 standard deviation being 15 points. So -2 standard deviations is 100 minus 30, which is 70, and IQ scores below 70 are deemed to be in the range of intellectual disability, what used to be called mental retardation. And then going the other way, the average score is set to be 100, so 1 standard deviation above would be high average, 2 would be superior, and then very superior above that. So we have these two different graphs. One is a horizontal graph, the other is a vertical graph. And then what we did was we put those two together. So here we have, from left to right, the degree of atypicality, ranging from severe to moderate to mild. And then we superimposed on that a second graph, degree of intellectual functioning, from intellectual disability. This would be borderline, 100 would be average. I didn't mark it on the scale, and then up here would be genius. So we have all these different combinations. And I tried to let the color values work. So over here, yellow represents intellectual disability, and blue represents atypicality. So people have a combination of intellectual disability and atypicality over here. This is green, yellow plus blue is green, and so on. But high-functioning autism, so-called, is embodied by individuals who have moderate to severe atypicality. In other words, on the left side of the x-axis, over here, the left-hand portion of the x-axis, but they also have IQ in the normal range, so they're above 70 somewhere. In distinction, down here, we have individuals who have exactly the same degree of atypicality. Remember, they're in the same place on the horizontal axis, but on the vertical axis, they're down here in this range below an IQ of 70. So these are individuals, children at the outset, of course, who have moderate to severe atypicality and an IQ below 70. And let me just say that I don't pretend that I can measure IQ in an infant and say that the child's IQ is X. This is a theoretical map, and I would often tell parents, this is the map that we're dealing with. Right now, your child's ship is in the fog. We can't see exactly where your child is functioning because your child doesn't understand what it means to be tested. I can't command your child to do his or her best at will. So this is in some ways a mental model, but not necessarily something that I can pin down in any particular child on day one. Down here we have kids who have predominantly intellectual disability. That's their larger issue, with a touch of atypicality. So mild atypicality, but their predominant issue is intellectual disability. And then in the upper right-hand quadrant, we have individuals who also have mild atypicality with IQ in the normal range. And these are the children who, if they're hyperverbal and socially intrusive, Lorna Wing and Uta Frith referred to as having Asperger syndrome. Tony Atwood also. This would be Asperger syndrome, although Asperger himself didn't use the term, and he described children in all 4 of these quadrants, but that was the name that stuck to these kids. Also up here are a lot of individuals who heretofore were labeled as having pervasive developmental disorder, not otherwise specified. And then out here, as you will remember, we have all these other things that are not quite autism, but clearly autistic-like. Not quite autism includes semantic pragmatic language disorder, nonverbal learning disability, broad autism phenotype, and what OTs refer to as sensory integration disorder. These are not all synonymous, but they overlap and usually have a touch of atypicality in the picture, in the mix. Now, we take this two-dimensional graph and we give it a little twist. So imagine that this graph is literally like a piece of paper on a stick, and you're going to give the stick a quarter of a turn. But before we get to the slide after that, Here's a loaf of bread. Why on earth did I stick a loaf of bread into the middle of this presentation? Because what we're going to do is go from this single sheet to a series of graphs, and each graph is going to be stacked on top of the one next to it like the individual slices in a loaf of sliced bread. So just keep that image in your mind. So here we have, as I've said, this XY graph with severe to moderate atypicality, and then IQ on the y-axis like this. And this might be conceptually the graph on which we might map where your child lands at the time of initial diagnosis, let's say at 18 months of age. And then here's another similar graph. This might be a year later. This might be a couple of years after that. This might be a couple of years after that. And this might be even further along. And you begin to get the picture that each of these slices is a slice in time, and it shows us where on this graph the individual is at subsequent points in time. But instead of drawing all of those slices, what we do is we put a third axis. This is called the z-axis. So the horizontal axis is the x-axis, the vertical axis is the y-axis, and this third one coming out of the plane of the paper, so to speak, is the z-axis, and this represents time or age, and it's kind of coming at us. And I tried to get that kind of screen crawler effect with the printing here to contribute to that sense. And here we have two representative children. Child A has moderate atypicality, so they're at the point, kind of at the midpoint along the x-axis, moderate. They have the same degree of atypicality, the same degree of autistic features. But this child has an IQ of 100, whereas this child has an IQ of 55. And then what happens? Over time, the atypical features break up, they melt, they decrease. In some cases, they disappear altogether. In about 15% of cases, the individual grows out of the criteria in the book. So if you were to meet somebody as an adult without reference to how they appeared as a child, and you simply took out the DSM criteria, they might not meet criteria. Does that mean that everything has disappeared? No, not really, because most or many of these individuals still have subtle issues with eye contact or social reciprocity or language pragmatics or sensory issues or related mental health conditions like anxiety or obsessive compulsive disorder and other more serious mental health issues. But the overall thread that I'm trying to develop here is that for kids who start out up here, atypical features break up over time and dwindle substantially. Not so for kids down here. Atypical features tend to persist over time. They may become somewhat less prominent as the child gets older, although this may be counterbalanced by the fact that the child is now bigger and stronger. There's a milestone that's not in any baby book, and I used to warn parents about it, and that's the age at which your child, when he or she becomes agitated, is now stronger and faster than anybody else in the family. And that age tends to occur younger than parents are often prepared to think about. But this is the overview of the relationship between degree of atypicality, level of IQ, and the evolution of symptoms over time. And I picked two kids over here. I could have started with a child with a mild atypicality, a normal IQ, or mild atypicality and significant cognitive disability, and it would be similar. Now, as I mentioned before, there are a couple of caveats. This model has been demonstrated clinically and statistically, and I've published research on this myself, which is detailed in my book, and it works over large numbers of children. It's like tossing a coin. If I toss a coin 100 times and it's a fair coin, I can be pretty sure it's going to be pretty close to 50% heads and 50% tails. Maybe not exactly, but pretty close. But on any individual flip, it's 50-50. Your guess is as good as mine. So this should not be misused to be a crystal ball for a particular child. Rather, this is meant to be a roadmap. And I would say to parents, look, this is the map of the territory that your child has to travel. And we don't know exactly what path your child is going to take. But this is a map of the territory that lies ahead. And over time, it's going to become clearer to us exactly what path your child is taking across this map. But it would be a misuse to try to use it to predict on day one where somebody is going to go. And I'm not suggesting that it can be used for that purpose. And if you're interested in learning more, I would direct you to my book, where I've spent a fair bit of time reviewing the data amassed by various clinicians going back many decades, as well as my own research to substantiate this model. Well, I think I'm getting better at keeping my individual posts down to a reasonable length. I hope you'll agree. And if you would like to learn more, as I've said, go to my book. And next time we'll begin to talk about the applicability of this model over the long term. We're also going to drill down and talk about various of the features in that initial table of atypicality that we've only glossed over up until now, things like theory of mind, central coherence, mirror neurons, mental illnesses that may be associated with autism spectrum disorder, and so forth. So I look forward to seeing you again in another week. Thanks for stopping by.